What management's been doing for several years now is to continue to pile on, but never once really stopping to do a workload analysis. Now, there's some hope because we recently had a workload study, and the workload study is it's sort of an indictment. It's an indictment of the management structure here in Olympia, in that we've been saying, we, the people that actually do the work, supervisors, social workers, investigators, we've been telling our people in Olympia, our managers in Olympia, that we can't go on at this pace. You guys need to really stop and do this study. It took them 3 years to finally do the workload study, and now we have it, and we ought to figure out what it really says and use it to go forward.
We have been telling management for years that we cannot do the job, yet they keep adding more and more things on our plate, and we are not able to keep children safe. And the bottom line for me is, I have a job to do. I love the kids that I work for and the families that I work for, and I can't do my job. And I want a job that is doable so that I can keep the kids, at least in the area that I work in, which is Children Protective Services, safe.
The study identified that there's a large number of positions that need to be filled, but the positions that we already have, we have a large number of vacancies already. So something needs to be done. This is like a large, I don't know if I could throw this into a soundbite. There's a lot of different aspects of this. I think that we need to hire more people. I think that we need to treat the people that we have better so that we can retain the staff that we have. And I think that they should also be paid more. I think that, that pay is an issue for people. One of the many variables to retaining staff.
Those of us doing the job, the system is not broken. We're still doing our jobs. We're still protecting children. We're still helping families. We're still doing the best that we can. We are having to run more and more in place before we can get to the job, and every time you run a social worker down by running them in place too long, they're less able to do their job and they're less able to get much accomplished. But we're still doing the job. That's still happening, and that part of the system is not broken. What isn't working is that our administration does not understand the job. They don't seem to understand that they don't understand the job, and so the obstructions placed in front of the social workers have grown greater and greater, and that isn't working well. But I really would hesitate to say the system is broken. We're still providing safety for children, and we're still helping families.